Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And I'm excited that we have a great guest today, Irene Iancu, who is a Canadian RRDH, an entrepreneur who owns her own dental practice in Toronto. She's known as @toothlife.irene on social media, where she shares her love and knowledge for all things teeth with others. Irene, thank you so much for being on the podcast.
Thanks for having me. Nice to see you virtually, although I just saw you in Chicago, which was even better than virtual.
Absolutely. Yeah, Chicago Midwinter
Yeah.
Meeting, which I think it feels like things are coming back a little bit with trade shows, which is nice. It's been taking a while to come back, but I thought it was a great meeting.
hmm
And you were podcasting at the meeting, right?
Yeah, then we saw each other in the I like how conferences are now really adapting to give us space because I remember we've been doing this for a while, but I remember just like finding an outlet anywhere. Alan Mead and I at one point we sat on the floor recording because we had nowhere to go. So it's nice that conferences are creating these little podcast hubs for us to have power and a seat and some water, just giving us the essentials.
Yeah, I didn't do any podcasts. Well, I did podcasts, but I didn't do the
You
Patient
were
First
recording
podcast.
with a bunch of peeps.
Yeah, it was fun.
You were
Yeah,
getting famous.
it's exciting just how podcasts is were really taking on. Alan Mead, who you mentioned, was went to dental school 1 year ahead of me, so I know him really well, and he's yeah, podcaster.
Yeah.
And I remember when I first started this podcast, I went to his meeting, The Voices of Dentistry, and I had just signed up for a podcast because I met somebody at a trade show, at a tech show, and they were starting doing podcast producing. And they
Mm.
said, I'm a sucker for anybody starting a business. So I was like, oh, you need people to do a podcast? And he said, yeah. And thus this was born. That's how I
And there
got
you
going.
are. This is where you are. That's cool.
Yes.
That's
So how did
awesome.
you get into podcasting?
At the time, there were no Canadian. I'm a dental hygienist by training, as you mentioned. I'm a restorative hygienist now. When I graduated, I was a hygienist, a standalone hygienist, and I describe it what I was versus what I am now. And there were no Canadian dental hygienists with podcasts, so I wanted to be the first. I also really liked social media as a medium for learning. Although textbooks are great and going to conferences is great too, I felt like I had all of this like wasted time. I was traveling to and from private practice, some days about an hour and 20 minutes. And listening to music and listening to the radio gets old. So I thought it'd be really cool if I had my own space where I can interview people. And I was listening to other podcasts. So that's just where it started. I had a co host, and then she left to pursue YouTube. And then I had another co host, and then that didn't work out. And now I'm solo on the podcast called the Tooth or Dare podcast. And I don't tell anyone, but I prefer it. When it's just me, myself, and Irene, there's a lot less logistics to have to deal with organizing another human being as a co host.
So I also had a co-host when we started this. It was
With the
first called the
T.
Operatory. Oh yeah, it was called the Operatory, and one of my good friends who didn't have anything to do with dentistry gave the patient perspective. Then he came and
Mm.
worked for my prior company that I sold, and so because he went with the company, then he was no longer my podcast host. So it was, and in fact, he just came on as a guest,
Mm.
and we're gonna have him as a recurring guest now, just because it's things have shaken out. But it's much more logistically
Yeah.
feasible to do podcasting when it's just me, myself, and Brian. I guess yours has a better ring to it.
Did you watch the movie Me, Myself, and Irene?
Absolutely, I did.
Okay,
Yes.
so sometimes it depends on who I'm speaking with. Sometimes that reference is lost among non-millennials or anyone younger than the millennial age. They just look at me like I made a bad joke, but I'm glad that I'm among friends here.
Yeah, it might shock you to know that I'm not. I'm older than a
You
millennial.
mean you're not a Gen Z?
I'm not a Gen Z. Or I heard that the new generation is called. One author calls them polls because both
Holes? Like
polls.
Pete holes.
Yes, because for two, this kind of has two meanings. One is because of the polling that because everybody's so divisive right now, and because the poles are melting. That's why.
Oh,
So that's what.
wow. This is
Yeah.
so sad. This is what we've come to. This is
Yep.
horrible.
Yeah. Because
Oh,
yeah.
man. It was like summer in Chicago when we were just there. And one day it was torrentially downpouring and sleet and hail. And the next day was 18 degrees, which is like in the 60s for the Americans. It's
Yes.
crazy. The world is
Yep.
falling apart.
but it's much warmer in Minneapolis now. So that's one of the positive things. Speaking of which, you
Let's do
mentioned
it.
that one of the reasons why you started a podcast was there was no Canadian hygienist. So what do you
Correct.
believe that your Canadianness brings to your podcast that's unique?
Geographically, obviously, it's nice to have someone in your own country. The way on the operational side, coding and questions about procedures and how things are billed is very different in Canada than in the US. For example, we don't have this thing called a prophy, whatever
Mm.
that means for you. I guess it's a maintenance appointment for someone that doesn't have bleeding gums, which I'm almost certain doesn't exist because every human on the planet that I've ever seen has had some sort of area of concern. So we don't have this differentiation between SRPs and prophy. For us on the billing side, everything is based on time as it should be, I believe. So that's one unique thing that I think I talk more about. And I understand both aspects of it, so it's an interesting communication piece. And that's it. Just yeah, those would be the two things. Geographically, having someone here on the ground speaking our language and then speaking our clinical language too.
That's great. Would never have thought of certainly the second one, but that's great. And I wanted to mention because you're an RRDH,
Yeah,
and up until reading your bio, I had
yeah,
never heard of an RRDH for because
yeah. We're pirate.
maybe
You have
that
to say "r" like you're a pirate.
RRDH. There you go. Yes,
RDH. Yeah,
we have a pirate theme ship over here at Toothap, so that's very much appropriate.
great.
So the extra R, is it for restorative?
It is. Yeah, the R stands for restorative registered dental hygienist, which means that I graduated as a registered dental hygienist and then I went back to school to become a restorative hygienist, which is a program that focuses strictly on restorative, which means I can do everything except prep a tooth. So I can't remove enamel or dentin. And I can see a preparation from its post prep all the way to an insertion or a cementation or direct or indirect composite filling, glass enema, you name it. So I can do everything after the prep.
Gotcha. Great.
In the
Well,
United States, the equivalent to that would be like an EFTA. And
mhm.
there are some states in the United States, like Arizona, for example, that graduates dental hygienists with restorative functions. However, it isn't an additional letter or credential. It just depends on where you graduate from and what state you practice in. So again, on my podcast side, like this is an interesting conversation piece because the reciprocal credentials from one state or one province to the other may be different. You just have to know what you're allowed to do, which in some cases is confusing, of course. Except when you have the extra R, then you know automatically what that means.
Yeah, in Minnesota, it's called expanded functions,
Yeah, F
I
does, but
believe.
that's not for
Oh, EFTA.
hygiene, it's for assistance. So a dental assistant can have expanded functions and be considered
Oh,
an EFTA, extended functions dental assistant, but that same credential can't be given to a hygienist, which is crazy.
that's great.
Craziness, isn't
Yeah,
it?
the when you unpack how the licensing and how that's done,
Yeah.
it is a little,
And to
uh
think about it too, that a dental assistant, and I don't know about the programs that you have in your state, but a dental assistant could probably get through school within 2 years, I'd say 18 to 24 months, maybe.
mhm,
And a dental hygienist with a bachelor's degree, maybe in school for 3 to 4 years. And then the dental assistant can get this extra designation that permits them to put in a class two with less schooling, but then a hygienist with more schooling doesn't even have that opportunity to take the same course that the assistant can
wow.
because they don't have the prerequisites, although the program is basically just the same, except hygiene now also has a scale. It's crazy.
Yeah, it's
Let's
interesting.
fight about this.
I personally don't. I know that there was a lot of fighting when expanded functions were coming into play, and I always equate this to I'm friendly with one of the tech people in dentistry who's like lectures about technology, and I remember I talked with him, and we were talking about teledentistry,
Who is this?
and
Are we allowed to
I
know?
don't want to name him because I'm going to say something that he said that
Oh,
was, I think,
okay.
wrong.
All right.
If we were better friends, then I definitely would
Okay. All right.
not
Okay.
say it, name him because he said something wrong. But we were talking about teledentistry, and he was giving me his perspective on teledentistry at the time, and he said that it's problematic because what's going to happen is then you'll have a hygienist to go out to a remote area to be seeing patients, use teledentistry to talk to a dentist who then diagnoses a problem, and that dentist won't go out there. The patient will come to the dentist, and I was like,
God
sounds
forbid
like
we
that's
should have more access to care. God forbid that a hygienist can willingly go out of state, out of province, into a remote area, packing their own equipment to provide care to people that have no access to it or are unable to get access to it. That to me just sounds horrible.
yeah, that's what I was like. Sounds like exactly what should happen, right? And after about talking for 30 seconds, he was like, "Oh yeah, I guess so." And so
Right.
I think it's just like people come at from a defensive perspective. This is going to take away from me, and I don't think that's at all true. But when we were talking
That's a
before,
huge perspective in restorative hygiene. So that's a huge problem that we have here. Maybe this is our topic for today, actually,
I think you
because
wanted your topic to be dentist dictating what you
well,
do,
that's
right?
part of that's I guess it all
Okay,
works in into one. But it's a huge problem here because dental hygienists are going into restorative with the expectations that they graduate, they go back into private practice, and they're utilized for their new skills. And I found this as a theme among those those that were my colleagues in school. So I went back to school for restorative in 2021, end of 2020 over 2021, and I had just opened my own practice. So I was 9 months into startup practice, and I said to my team, if there was no better time than now for me to leave when we're still acquiring patients and still getting our systems in place. They argued that it was a bad idea. I argued that it was a good idea, and in the end I won. So I went back to school, and in a class size of like 20 or 30 people, which doesn't seem like a lot, that's 20 or 30 hygienists that now are no longer going to be, or hoping to no longer be, providing perio services, and now jumping into doing full restorative, which what that means for a dentist is it's rendering you double the production. So if you're already operating out of 2 rooms, then now maybe you're operating out of 3 rooms and you're bopping back and forth and prepping, and someone is following you around, filling and filling. Economically, that makes huge sense. But what it ends up happening, and there are a few dentists that have come at me on social media about this, that they don't trust the clinician to do the work that they prepped and whatever the grievances are on the other end. But the reality is, you take just as much risk hiring a new grad or a new dentist or an associate. If anything, you have less risk because you're the one still prepping the tooth. So that's an issue here.
yeah, I don't. I've always been one to delegate as much as possible to auxiliaries because, like you said, you
Good.
not only increase your production, but I think that then you have more specialized. Then you're more specialized, which leads to a higher quality of care. When I would see a quadrant of composites in my practice, now as I got towards the end of when I was seeing patients every day, I there were some technologies that came out like sonic fill that made it easier, but filling composites, we say composite in the US, by the way. Not what did you say? Composite? Filling
Mm-hmm.
composites was just laborious and boring
Yeah.
for me. I didn't like but then so that sounds amazing to me to have somebody else like if all you do is the prep and then somebody else does the fill, that sounds fantastic. So
Yeah.
do the dentists you work with, they must love that.
Yeah, I guess it depends on the schedule, right? If a schedule falls apart, and it depends on how people are earning a living. So I don't want to get into the logistics of contractual obligations, but yes, generally speaking, it is far easier to have 2 people working in 2 or 3 different columns doing restorative. And for example, if you have a longer procedure, so if we've got a long procedure in op 1 where perhaps she's prepping 3 or 4 crowns, you can pause. Like, you can pause and then go and prep 4 or 5 restorations in another room and then still go back to complete the restorations that you're working on. So yeah, it's nice. I think it's nice. I think it's great. She thinks it's great. We all think it's great, but not all of the world thinks it's great.
So what would you tell those people that don't think it's great?
If you're not moving forward, you're falling behind. So with technology, in dentistry, in every aspect of our lives, if you're not progressing to be more efficient, then you're going to continue to stay where you are. So you'll get you can recuperate a couple of points in each area. So let's say your goal is to make more money. Then what are you going to do? You're going to cut your salaries, you're going to cut your overhead, you're going to do faster work, which may be sloppier work, may not be as consistent as you'd like. So, or you're just going to just spread yourself so thin. Think of restorative hygiene as a capability for you to have a greater earning capability, but also to expand the profession as a whole, which ultimately 10, 15, 20 years from now is the legacy that we're all trying to leave for ourselves and for our profession. So I don't know. I think it's just an antiquated philosophy that everything will stay the same when really nothing ever stays the same. So you're either part of the problem or you're part of the solution.
You bring up a really good point. Right now, when I got out of dental school, about half the adults in the US saw a dentist regularly. Today, after 25 years of progress, we have half the adults who don't see a dentist regularly, right? And I was talking with somebody who's in consultant in dentistry and talking about how if most practices actually saw the patients that are of record on a regular basis, they would be able to see about 20% of patients.
Mm,
And I think it's embarrassing when you look at there's some embarrassing statistics that we have in dentistry. And if we were and then there's a labor shortage across the board. So like you're
right.
saying, something has to happen. Either we're going to continue to have these sort of embarrassing statistics of how many patients actually get seen. We're going to magically wave a wand and have a lot more people in dentistry, which that isn't going to happen anytime soon. Or we're going to have to do a lot of things differently. I think
Hmm.
automating whatever we can through technology, I think is a major focus of mine, but also delegating, like you're saying, whatever we can makes the most sense. My chairside assistant that now is our director of customer success for Tooth Apps. We worked chairside together for about a decade, actually more than a decade. And she helped do training for the hundreds of dentists and prep the models that dentists would use for the courses that we did on CAD CAM. And I would tell every new associate, like, I don't know how you prep teeth, but I know how Abby does, right? So she's going to be watching your preps. And if she gives you like
Hmm.
feedback, you're the dentist. But let's face it, we have very talented people in our practices. And I think it's important to be able to, if you're going to hire the best people, they're not going to want to just sit there and be
Yeah,
told
they're gonna
what to
leave.
do all day
That
long.
that is the reason why I own my own practice. I've been a hygienist for 17 years, and I bounced around from practice to practice thinking that I was filling the void that I was looking for. I went from working in a pedo practice to working in a perio practice. I worked in an ortho office, then a cosmetic. Like I just kept moving around every couple of years because something just didn't feel right. And what I realized it was I didn't have this career satisfaction. I was good at my job and I was a good employee, but I didn't feel fulfillment at all because of
Mm.
this lack of delegation. It was always like I would push for something and then the answer was no. So that led me to wanting to open my own practice. And if you ask many employees, if you do an exit employee survey or ask people as they're coming into your practice why they left, or if they had an option to choose a different boss or more money, most of the time they'd pick a better employer over a couple of extra bucks per hour because it makes a huge difference in how we feel valued and how we feel appreciated and how long you'll have an employee for.
Yeah, I frankly thought that was one of the biggest challenges of growing dental practices was providing opportunities for really skilled employees to elevate to continue their career growth. Because if you're let's face it, if you have four chairs in your practice and you're doing the same thing for 20 years, it doesn't provide an opportunity for people to grow very much. You can bring in new technologies, obviously. You can do some things, but like having career growth, it can be challenged. So did you go in did you so it sounds to me like you didn't go into hygiene or even into getting your RRDH to own a practice that you were pushed into it. Is that correct?
Yeah, I think so. I got into dentistry in kind of a weird way, and I didn't really love it at first, and then I learned to love it, and then I really loved it, and then I wanted more. And once that light switch went off, that's where it led me to opening up my own office. I didn't know It's funny, today's a leap year, so I don't know when this episode will air, but I write a leap year letter to myself. So I wrote one this morning. This is my leap year letter to myself. So I wrote, this is my third leap year letter. So I open it and then I write the next one, and I thoughts and any dreams or wishes or aspirations or things that I hope that I achieve within the next 4 years. And it's on a postcard, so it's not a long letter. But I opened my last leap year letter, which was in 2020. And then I remembered the one before that. And I didn't even comment about opening my practice. My practice is 3 years old, so it took me 12 months to get everything going. It just happened. You're right. I willed myself into it, but it was the next best option for me. I couldn't find the office that I really wanted to work in that had all of the things. So I had to create it myself.
Very cool. Very cool. And so last question, any advice you would have for a hygienist that's working in a practice right now and is feeling stuck? Because I think that's
Mm.
probably fairly common in dentistry.
Yeah, I think the pros and cons list was the place where I started. The last office that I worked in was a highly producing practice that had 6 restorative hygienists, 4 associates, 3 floors, multiple operatories, oral surgery, all of the procedural things that I would have ever wanted in one place. The only problem is I didn't own it. And I wasn't the one that was providing the restorative services because at the time I wasn't a restorative hygienist. So I started with a pros and cons list, a list of the things that I loved and things that I didn't love, and which of those things that I didn't love was something that I physically was able to change on my own by making strides, by implementing new systems, and what did I actually want to invest in that practice. And unfortunately, the cons list was a lot longer than the pros list of the place that I worked in. So if you can't change from within the place that you work in, and I don't want dentists to come at me saying, oh, my employees now listen to this podcast episode and they're listening to Tooth Life Irene and they're all quitting. If you can't change from within, and you need to ask for help. Like you need to physically be able to go and say, I need help because I'm feeling burnt out. I'm feeling unappreciated. I'm feeling like I have no control over my patient outcomes because I don't have the right equipment or the right resources. And that is usually the thing that hurts us the most. That was my final straw. Which of those things on that cons list was going to be a deal breaker for me? And the deal breaker for me was my inability for me to treat patients the way that I knew they ought to be treated by having the right resources, technology, services, products in my operatory to be able to do that. That's like me telling you, Brian, I need you to do this endo. Unfortunately, we don't have any gutta perca for you and you can't buy it. Then what are you going to do? Chewing gum?
Refer to the
What's
endodontist. Just,
no, that's not an option. And you
yeah,
only have
yeah.
30 minutes to do it. And
Oh yeah.
I'm going to dictate your treatment to you and tell you what you need to do. Although you have your own license to uphold, your own professional liability insurance to uphold, your own ethics board to report to, but someone else is going to dictate it for you.
That's a great point. I think dentists
Sucks.
look at it like it's my license, my
Yeah.
practice. I can only I can diagnose, which is true. But there's also another professional with a license that has to provide care that you certainly have to the collaboration
My
for sure.
biggest pet peeve, and I'm just going to
Mhm.
say this and not go into it. My biggest pet peeve is when I see marketing that dental practices do that discounts somebody else's work. So the $99 cleaning or the free whitening or the whatever that is often not done by the dentist, is done by somebody else in the practice. So when I see that, it irks me because I know that the hygienist on the other side is wondering, what the heck is a $99 cleaning? And why am I the one getting my work discounted and not the dentist? Why not you do a $99 filling or a $99 endo or a $99 crown? Most of the time, it's the hygiene stuff because it seems to be the supplemental work that is discounted, and it's discounted and it's done in a way where it's actually not us we're not consulted for it. So it deep down, it's a little knife in our hearts every time we see that. I'm just gonna put
That's a
that.
very interesting. I
Gonna
have a
put
different
that there.
perspective on it, but
I'm sure you
because I
do.
yeah, because I it's because everybody needs a cleaning, not everybody needs endo, right? And so that's
Everyone
how
needs an exam.
yeah, that's true. Absolutely. Yeah, and that's a very good parody, I guess, right there. But yeah, no, that's very good perspective.
I'm gonna
So
go dig myself a
thank
grave
you.
now. Bye.
No, no, it's great. I very much appreciate you bringing up
Furiously
lots of
doing a
insight.
Rubik's Cube to get the stress out.
That's what stresses me out. Oh my gosh. Yeah, no. Irene, thank you so much for being on the podcast. Where, if people want to go to find more information, where should they go?
Sure. Instagram, type in Tooth Life Irene, and I should be there.
Tooth Life Irene.
All of the things.
Thank you very much.
Thank you.
Appreciate you being on the pod.
Bye.